Okay, so we talked through the problem, which is hyperactivity through traps and pec, and the weakening of these muscles down here. We want to strengthen these up, right? We talked about how to shut down some of the pain signals and kind of soften up some of these tissues here, so we can actually start engaging these. Now I want you to perform exercises. So this is going to apply to all exercises. So you might need to take down especially things like pulling and pressing at first, because sometimes when we over pull, what happens is you're gonna go to those strong muscles, right? Traps are gonna take over. When you're pressing, same thing, you're coming down to the bottom. The scapula is gonna kind of rise up, and then you'll end up pressing off this area, and then that's gonna aggravate that shoulder part or the neck. So what we're gonna work on is posture. So we wanna engage these muscles down here. It's almost like if you look at the scapula like this, so that's kind of your shoulder blade through here. At the top of the scapula, all these muscles are overused, so these are trap muscles up here. We want to engage almost like these lower trap, lower kind of like rhomboid-ish areas to kind of help pull the shoulder blade back and down. You can kind of see already the neck and head is in a better position when we're engaging these lower muscles. So one way to do that is you take your hand, put it back here. I always it really helped me to help have something to kind of almost palpate the area that I want to engage. And then using this hand, I want you to try to flex against that hand and pull that shoulder back down and in place. Now the key here is all of your movements, whether you're pressing or pulling, whatever. Yes, you can probably do a lot more weight, but from a rehab or prehab perspective, I want you to focus on engaging this muscle, holding it there, and then you're doing your pressing. So sometimes it's easier to do with maybe bands. You can be a little bit more meticulous in how you're doing it. If you're going to use actual weight, that's fine. I just want to make sure that you actually can feel that muscle engage, right, while you're doing it, while you're pressing and pulling, and keeping that scapula or that shoulder blade kind of pressed against your body, right? You're using these muscles here to pull it in, right there. So whether you're pressing up overhead or pulling down, we want to keep that blade against the body, or whether you're pressing or pulling horizontally as well. Now you can do a bunch of band exercises. I really like the crossover symmetry stuff. Really the big concept is all we're trying to do is just shut down some of these trap muscles while we're pulling back and doing exercises that engage these lower traps, so you can control where and how your scapula is kind of moving on your back. So it's going to take a little bit of practice, but the real key is I want you to know what muscle you're trying to engage that muscle, right? And then do all of your exercise, because that's what's going to heal you, right? You can either do, just like any squat or deadlifting or running or whatever, the exercises can be the best exercise in the world or the worst, depending on how you do it, right? It could exacerbate your issues, or if you're not doing it correctly, or if you're doing it correctly, it can fix your issues, right? So if we're getting we can fix ourselves by actually pressing, if we're pressing in the right position, right? Because we're trying to train the body to press in a certain movement pattern, right? So the key is going to be understanding the load. Don't exceed your tolerance for the actual movement pattern. Remember the pattern, we want to preserve the movement pattern first. This is the goal, and we're only going to do as much load as we can to preserve that movement pattern, because we're training the brain to keep these muscles engaged. If you overdo it, you're going to go to your stronger muscles, and then you're going to get back right into the same position that we were in before. Okay.